Okay, so thanks so much for joining us to Sexual Health Pathways with Steve. I would like to welcome everyone to today's webinar, and I would like to start today by acknowledging the traditional custodians of the land in which we meet, live and work. For us, where we're sitting today, it's the Wadi Wadi people of the Darawal Nation, and thank you for those who have utilised the chat box and let us know what country you're dialing in from today. I'd like to acknowledge them as well. We recognise the powerful connection to land, waterways and sea, and to community. We would like to pay respect, our deepest respect, to elders past and present and emerging, to families, communities and survivors, and to those who never made it home. As we share in our knowledge, teaching and our learning in this space today, may we also pay respect to the knowledge embedded forever within the Aboriginal custodianship of country. So my job's really easy today. I am just introducing the fantastic Steve Gibbeson, who is in the room just over there next to me. Steve is the Program Manager for Health Pathways in the Illawarra Shoalhaven Local Health District. And we're really lucky to have him join us today and give us a real run through of what Health Pathways is and how we can use it in our work and the work that we do with our clients. Steve will give us a tour of the pathway, and just looking at the number of participants we have, it's a really nice group. So we might have a little bit of interactive components to that live tour, which is fantastic. And I guess it's all really about familiarising ourselves with the site so we feel comfortable and confident to be able to use it in the work that we do. So I am going to pass over to Steve. If there are any questions, please write them in the chat box and I'll make sure that Steve can get them and answer them as we go on. So thanks so much, Steve. Over to you.
Well, thank you, Maddie. Hope you can all hear me.
Yes.
I'd like to welcome everyone here today. It's quite exciting for me to be out of the home. I've been stuck in the home for about 6 weeks now with a leg injury. So I'm out with Maddie and Jen today in the office. So it's quite exciting. Anyway, what I'd like to do is introduce our team to you. Health Pathways, Illawarra Shoalhaven. I'm the program manager and have been since we started in February 2015 as far as starting developing the website. And Louise Delaney, that you can see there as a part-time clinical editor, has also been with me that whole time. And Louise Delaney works part-time with us, but also works for the parent company for Health Pathways. So she's looking, at a medical advisory role for Health Pathways across Australia, New Zealand, and also the UK. So it's an absolute privilege to have Louise working for us part-time, but also doing that role, and also working in practice at Helensburgh. Jen Hogben is a very experienced GP that works in the Wollongong region. She works at Oka. And she is just absolutely fantastic. And all of our GPs love Health Pathways and they depend on it. They have it open all day and use it all day in their practices. Solly Javara, she's down at Berry at the moment, but was also at the Moss Street Medical Practice at Nowra. And Aniko is Ujvari, is also a GP who is moving up to Brisbane, so we'll lose her soon. But she has just been absolutely fantastic and worked at the university in the GP clinic there. And Rebecca Goodman from Bulleye Medical Practice, who joined us last year and is fantastic. So that's our team, and they're tremendous. They work, up 4 to 8 hours per week on Health Pathways, and they work with specialists in the local area. So we match up with maybe the clinical director of a clinical stream, and then from there we go with a specialist that's recommended and work through pathways. So if we want to move on to the next one, and I suppose the little symbol that I had up just before is that Health Pathways is funded by Illawarra Shoalhaven Local Health District and also Coordinair, the Primary Health Network. So it's both federal and state funding, and there's no sort of private commercial interest in this. So It really is there for GPs and other health professionals to use and feel comfortable that there's no, private enterprise bias in Health Pathways. Okay, we'll move on, Maddie. Thank you. So this is what the site looks like, and I'll work through it in a moment. That's just a snapshot of it back in late January, I think. So we'll get to that, but you can see there we have the nice coastline of the Shoalhaven, and we have the Illawarra flame tree. So when you get to that site, that's Health Pathways for Illawarra Shoalhaven. We'll move on, Maddie. So you can see from last year what was used most on our site. And you can see in the clinical area, COVID initial assessment and management by far was the most popular from mid-March onwards. Antenatal pathways, routine and first consult are really, really strongly used. There's a shared care program with the GPs. COPD, chronic hep C, which is always very popular because of an antiviral medication that's come in many years ago that 95% of people overcome hepatitis because of that medication. Non-acute asthma in adults, hypertension, probably sign of the times, hypoglycemia in pregnancy, burn injuries and eating disorders. So they're the ones in the clinical area there. And I think the burn injuries was more just in January of last year when we got that pathway up quickly for what was happening in the Shoalhaven. And the eating disorders, I think it's more because it's a new pathway that was clicked on a lot last year. But still an issue in the area. The top 10 search terms, I think there's no surprises there. That's what GPs are searching for on the website. And, the search facility is probably the most efficient way to find things on the site. And then as far as the request referral pages, again, no surprises there. They're looking up gastro or mental health, gynecology, respiratory, obstetrics and neurology, just to look what the criteria is for referring, what information there is for referrers and who are the specialists, and then referring to those specialists. Drug and alcohol assessment and treatment, and then the support services linked to that, and then termination of pregnancy services. So I'll talk to that in a moment. What I could say is, while we're on that page, this year, antenatal, first consult and routine are the most popular pathways at the moment, but I think that the COVID vaccination pathways will be the most popular and have been in the last week. Hypertension's still up there in the top 10. Hypoglycemia in pregnancies as well. Anxiety in adults is in the top 10 at the moment, and probably hovered around that last year as well. Perinatal mental well-being, osteoporosis. There's a colleague referrals pathway, which I'll go to a little bit later, a GP colleague referrals pathway, and hepatitis C again, and adult psychology and counselling, and smoking cessation. So they're the type of things that are happening this year so far, where GPs and other health professionals are clicking on it. Okay, moving on.
Yeah, Steve, just before you move on, we've got a private question that's come through to me just about Health Pathways more nationally. So it is a national thing.
Yes,
we're talking about Illawarra Shoalhaven specifically today, but maybe you can speak a bit to that.
Yeah, I think the next slide might give us something on that. So, well, before the next slide, that is how you get into Illawarra Shoalhaven's Community Health Pathways. The username is connected, and the password is 2pathways, numerical 2, all lowercase. So that's been the username and password since we started in 2015, and I don't imagine it's going to change. Everyone's used to that. And if you put in that username and password, it should remember you for the next 12 months on your cookies in the background of your computer, unless you change your computer. So moving on to the next one, because we might be able to answer that question. So as I said, we've been live, we've been live with the site since October 2015. It's mobile friendly, so you can use it on your mobile phone. You can type into your mobile phone now and put in Illawarra Shoalhaven Health Pathways. You just got to remember that username and password of connected and 2pathways. We've got 550 pathways that are localised to our region. And the usage is climbing year upon year, and I'll have a slide in a moment to tell you that. But as far as Health Pathways is came from Canterbury, New Zealand in 2008. And then the first one to pick it up was Hunter, New England, around 2011. And then since then, it's just grown and grown. And, you know, there's 10 regions in New Zealand, 30 regions in Australia, including 12 in New South Wales ACT. So maybe the only site that hasn't had it is far west in New South Wales, but I think they still link into the Murrumbidgee and some of the other sites that have got them. So, and the whole of Queensland is, you know, it's funded by their particular state government as well as the Commonwealth. And then 3 regions in the United Kingdom too. So yes, it is all over the place, and you know, we can supply username and passwords for other regions when you need them. Moving on, Maddie. And then as far as the usage goes, for last year, you know, the page views were up around 58% from the previous year. The sessions were up 94% from the previous year, and the users were up 8%. So what that indicates is that we didn't get a dramatic increase in users last year, but those that came and used the site just kept coming back. And really the trend is continuing this year. I was worried that we wouldn't have, you know, an increase compared to last year because it was so popular in March with COVID. And certainly earlier on with the fires, but the users are up 31% this year from the same period last year. The sessions are up 79%, and the page views are up 51%. So the site and people are hearing about it, and they're getting on there. And you know, the last week in regard to vaccinations, it's just it's crazy how many people are on the site. So it's fantastic. Hopefully that answered that earlier question, Maddie. So what I can do now is share the screen. And so I've just got to go down the bottom here and then share. And then what will happen is you'll see our Illawarra Shoalhaven Community Health Pathways site. And it's called Community Health Pathways because it really is for the community, even though this site is for health professionals. There's another site that we'll develop, and it's called Hospital Health Pathways, and that'll be internal to the hospital system. But this is the site, this is the home page, and when I scroll through or go up and down, you can see some of the things like health alerts that we keep up to date, or linking to areas where they've kept them up to date, latest news, pathway updates, what's been new, what's been updated, and what's been reviewed as well. And you know, I can click on more updates, and it lists all the updates that we've done in the last couple of years. And then on the right hand side, you can see there is you know, some links to direct things that are useful to GPs and other people. And on the left is the table of contents. So you know, I'll go through the table of contents today, but the search facility is probably one of the most effective ways to use it. I know the table of contents because I'm working on it all the time, but you're not expected to know that. But one of the ones that appears at the top of the table of contents is COVID. On the left there, you can see, I'll just click on COVID, and it has all the COVID pathways. And so some of those pathways, you know, we've developed locally, but a lot of them we're working as a team, particularly across New South Wales, to develop these pathways. So Hunter, New England have taken the lead on these assessment and management pathways that were very well used last year. So they update them for us quite regularly. You know, we provide feedback, and so do our users, but you know, they're keeping it up to date with a whole lot of their medical teams and links to state government and Commonwealth government experts. But the one at the moment is vaccination. So with vaccination, there's an information pathway that came up in February, and then these vaccination procedure, and also they're preparing for COVID vaccination. So, you know, for example, like preparing for COVID, that pathway is up there. It was last updated yesterday. And I think it's probably to do with the AstraZeneca, and there's some information in there about that. So this is a pathway that, what pathways look like. Sometimes it's linked to others. It has background information that opens up. And this one, it's got information, practice preparation, general practice and authorised vaccinator prep, patient preparation, etc. And so there's quite a lot of information, and there's key links on the right-hand side. And while I'm there with a pathway, on the right-hand side, you can click on page information. It gives you information about when it was last updated, last reviewed as well. So what I'd like to do now is go into our sexual health pathways. And I suppose if I use the search engine and just type in sexual there, and you'll see a number of things come up, but I'll just hit sexual health there. And you'll see that sexual health, I'll just click on sexual health there to start with. You'll see on the left is the table of contents, and it'll go to that sexual health heading. When I look at where sexual health lives, it lives under medical. And so under medical in alpha order, alcohol and drugs, assault and abuse, cardiology, dermatology, et cetera. And then way down here is sexual health, but you don't need to remember that. So on the table of contents, so if a pathway is bolded the way they are all listed there, then that means that they've been local to our area. If there was a pathway in there that was a lighter colour, a greyer colour, it wouldn't have been localised to our area. So I'll just click on chlamydia as the first pathway. And as mentioned before, so this will have information in there, Aboriginal Torres Strait Islander information, and a flag will appear where that information is. Or it might be a multicultural health flag with all the different flags of different countries. And so there's multicultural health information in there as well. So with this, you'd look at background, you'd look at some background information about chlamydia. While I'm there, I want to show you the draft site, because this particular pathway, the last time it was reviewed or created was March 2016. It was updated in May 2019, but we're reviewing all our sexual health pathways at the moment. And so I've got a draft site.
Oh, Steve, I think you may have accidentally muted yourself.
Yeah, I'm back again now.
That's the life of touch screen.
Yeah.
All good.
So if I just type in chlamydia there on our draft site, it'll show you that we're currently working on this. So we're working on all our sexual health pathways. And so we're putting in a red flag in there that we didn't have before about sexually transmitted infections in a minor. So, if there's a red flag at the top of the pathway, it's something that is a concern that could really jeopardise the patient's health, or for the doctor, they need to know what to do about it. So red flags is an alert there, and that's something we don't currently have on our other pathway. I may have actually just closed up my other pathway. So I'm just going to click on this and get out of the draft site. But you can see there that we're working on this at the moment. Rebecca Goodman is working on this with Catherine Brown, Professor Catherine Brown, in regard to updating these sexual health pathways. So I'll just click on this particular this area again.
Yeah, just as you're doing that, another question's come through.
Yeah, sure.
A private message to me just asking how often the pathways are reviewed.
Yes, so they're reviewed every 3 years, but they're updated all the time. So our GPs hear things, I hear things, I talk to the GPs and we go, look, this has just changed overnight, this has just changed, and we get in there and update them. So, like that chlamydia one, as I said, it has page information on the right, and it tells you that it was last reviewed in March 2016. It's currently being reviewed now, and it was last updated in May of 2019. So with that chlamydia pathway, it's got background information, it's got assessment. So this is a typical pathway where you have perhaps a red flag, you have background information, and then you have the assessment with, perhaps a patient beside them for a GP. And all of these things drop down. So sexual history, and there's detail in there. We don't have all the drop downs open all the time, but you can do that if you want, but it becomes too long something to look at. So it has the assessment, and then it goes into the management area. So the treatment, contact tracing, and management of sexual partners. And it links to other pathways. So you can see there's links, screening for other STIs, HIV, hepatitis B, syphilis, gonorrhea. So then you would link to those pathways. So you can click on those live links. And then from assessment management, Then there's the request options. So refer to a specialist sexual health clinic. So, you know, I'll go into that in a moment in regard to sexual health. And then it goes into clinical resources that might be useful for the health professional, but also patient information that you can pass on to a patient, whether it's a brochure or whether it's a link to a website. And so you can click on any of those. And we keep our links up to date. I get a broken links report all the time, and you know, we're going in there to look to change them when sites change their links, etc. So the next one after chlamydia is contact tracing. And, you know, I questioned about the term contact tracing now under sexual health because of COVID last year and all the reference in this year about contact tracing. So in actual fact, on our draft site, we're actually going to have in there partner notification in brackets after contact tracing. So it sort of separates it a bit from the typical contact tracing in regard to infectious diseases. So this pathway, again, all of these pathways are being reviewed at the moment, but that one, the last update was in March 2016. But very soon, in the next 4 weeks, we'll have new pathways up. Now, in regard to how we do that, is that we don't just speak to a local specialist. We look at what's happening all around the health pathways regions, and we have in the background all the information about their pathways, and we share. So we know what they've changed when they've updated their pathways. So we might go to the last updated chlamydia pathway or contact tracing pathway. It might be in Sydney, it might be in WA, wherever it may be, and have a look to see what they've done. So all the time as a community, we're sharing pathways and we're getting the latest information, and we can take it, draw across all that information, rather than just relying on our local specialist to provide that information. So you can see there with contact tracing, again, it goes through. So I'll click on, say, this specialist health, sexual health clinic. So that has information there about Port Kembla, the services that are offered, the criteria, the costs, the availability, and then Nowra sexual health clinic and details, and then private options as well. So I know that this will be updated very soon. This probably will go up in the next 2 or 3 weeks, a new version of this, because I've been working on it in the background. But it'll be very similar. It'll just have some updates in there in regard to family planning and GCA there as well, and the payment schedules for that, and Illawarra Women's Health Centre and the teen clinic. So, so a lot of our pathways will link to referral options, and it will perhaps list specialists, which I can show you a bit later. Another pathway, if I go up or down.
Just before you move on,
yes.
Steve, while you're still around, you're talking about HIV, but around chlamydia and STIs, there's a private question in here asking, is there any pathways for women who test positive to one of those STIs and are victims of domestic violence?
Yes, yes.
Do they all connect?
Yeah.
In the pathways, yeah.
Yeah, we do. So we have some sexual assault pathways as well, which are also currently being worked on, but we have live ones, and we also work with domestic violence. So there'll be links in there in regard to those, and they link back to these pathways. So if I typed in sexual assault, sorry about that. So if I just go in there to sexual assault, there's services that if I go into the heading for sexual assault or abuse, adult or adolescent recent sexual assault, previously undisclosed, and then you could click on that area, and then it has a whole lot of information in there, background, assessment, these indicators, general practice assessment, STI screening, and contact tracing, domestic violence issues. And so it clicks to those pathways as well. And then management of that, the sexual health centre, and then request options. So does that sort of answer some of that in regard to, and then you would click to the various different pathways, and you can see up above in the table of contents, you know, the domestic and family violence pathways, signs and symptoms of domestic family violence, and then it's got some links down further on as well.
Yeah, I think so. I think it's just showing that all the pathways do connect.
Yes,
Yeah.
they do. Yeah.
Great.
So going back to, so if I just type in HIV rather than trying to find it in a table of contents, because it's probably the easiest way you guys can find it. So, you know, there's a COVID note on that particular pathway at the moment. So, you know, there's important information. There's a lot of red flags in regard to HIV as well. And then this pathway just opens up typically like the other pathways, assessment, management, and then request options, including links to mental health assessment, support services, and then HIV S100 prescribers as well. The next one, you know, well, we'll go down to the human papillomavirus, and we're changing that to just be called genital warts on our draft site. So that's going to change very soon, but it'll still have the same broad information in there as well. But will be updated with anything that's changed, perhaps. So that one, again, May 2016, but very soon we'll come up with a new version. So assessment management and then request options, and it goes back to that specialist health clinic and clinical resources, patient information. All right, so that's sort of like the sexual health area. I haven't gone through all the pathways there, but they're all available, as you can see on the left in the table of contents.
Yeah, great. I think I've got another question in here. It might be a good time for this one, around how you were talking about the reviews and the updates. Do services know that they're on the pathway is part one of the question, and part two is, do they send in updates to you, Steve, when things change or expand? So for example, like the sexual health clinic and the trans clinic, things like that.
Yes. So some services do, but not all services know they're on there. But the public ones do. And I do get provided with updates, but that could be a better system. So, you know, I know I'm going to get a project officer at the, later on this year. So that'll be one of the things that they'll be doing is assisting with that, because there is so much, and I do rely on people providing information as well. So yes, most of them do know, but not all of them when you get to some of the private things that we'll look at a little bit later. What I was going to do is go on to, say, transgender, and I'm just typing in trans, without an S there. Let's see if we can put that in there. And then you can see something that popped up straight away. So I'll just click on it, transgender health and gender diversity. So this particular pathway, when it comes up, I'll just show you page information that it was, well, it was really created for us in May or April last year. So it's not too old, and it was last updated in May. And in regard to this one, lists some contributors to this pathway. It's not all the contributors, but Alexia Pape, who is an endocrinologist in our district, and also Alison Rutherford, who's with the Illawarra Sexual Health Services as well, has been involved in this particular pathway. It's something new putting the contributors in, but I think that helps with a bit of transparency. But it's not as though they created this pathway. This pathway has been around in Sydney and the ACT, and we've drawn out the bits that are important for us. And it might be 90% of what Sydney's got as well. And then keeping it updated when there's updates elsewhere in different health pathways regions. So this information, it's got red flags, it's got background information about transgender health and gender diversity. And, you know, it's got a lot of information in there that I was reading through that was really, informative to keep you up to date with terms and different things like that, that's acceptable within the community. And then consider the patient's life experiences. So this is really good for GPs to go through, and the pronoun matter for trans people. And there's information, there's education on there, 2-minute videos, taking a history, and then you click on that and it goes through the history details that they can go through. So it may not be something that a GP can pull up while that patient's there, but it's something that they can really think about and educate themselves and become more up to date in regard to seeing
fantastic.
patients.
I noticed there's a couple of the flags, like the multicultural flags and the Aboriginal and Torres Strait Islander flags, which are fantastic. There's a question or maybe a suggestion in privately messaged to me asking about a pride flag or a trans flag to be included in here, and maybe even for things like breast checks and other cervical screens, including a trans flag or a pride flag.
Yeah,
if that's not already on your radar.
No,
it might be, but
it's not. It hasn't been suggested to me, but I think it's a great idea. And once they get suggested, we can chat about that. And our New South Wales team meets quite regularly to share pathways. We do pathway sharing, but we also talk about things like that, and then we can also put it to our technical writers. Because we work with a New Zealand team, when I come in of a morning, there's already a load of work in my emails because they've been up for a couple of hours.
Yes. I think it's great because you do your eyes drawn to those flags when you're scrolling through. I just saw it then. So
makes it easier. So there's quite a lot of information. Obviously, I'm not going to go into detail about these pathways. It's not what this is about today. But, initial management, it's got a whole lot of information in there. It's an incredible amount of information and ongoing management's probably not going to be too much shorter either. And then request options, which, is really important to who to refer to. So there's a whole lot of options in there: psychiatrists, psychologists, endocrinologists, sexual health physicians. So when you click on that, it goes to those areas and lists the available options, both public and privately. The gender affirming doctors list, child and adolescent mental health services, sexual health clinic assessment support groups, which I'll click on in a moment. And then that list goes down to other things as well. So that's a really big request. It's probably the biggest request section of any pathway in regard to the various options. So I'll just go back up and click on support groups. I think that would probably go to the same place as one of the other ones I mentioned. So that goes to the, at the moment, we've got it listed as LGBTI support services. And, I question we haven't got the Q in there and different things like that, but we can't be just updating pathways all the time. And we know that things change. They're on the move with all of these areas. So at the moment, a GP, a health professional, can find this pathway with LGBTI. So, it has that information. And then further down, it may refer to LGBTIQ+, etc., inclusion network and things like that. So on this pathway, support services. So don't think there's nothing under that because it's just got that. If you look on it there, it goes into the support services. And so then they open up as well. So these are the things that I'm updating all the time. So Rainbow Grand Pacific Health Support Group, open it up, and then it's got information in there as well. So the Gender Centre at Annandale or Trans Hub, which I think, I only put that in maybe December or something. So it's got information in there, a link to the website, and also description of what it is. So that, and when I look on page information on the right, I last updated that in February of this year, and particularly in regard to Facebook groups. And I've got informants that are keeping me informed of all of these changes. And so, this LGBTIQ plus inclusion network is in there now. And so they link up to Facebook groups as well. And there's Rainbow Families of the Illawarra, and this Illawarra Rainbow community above that. So you have to look through all of that to see, well, what's appropriate.
It really looks like that one-stop shop, doesn't it, for everything you need to know. It's great. There's some good feedback coming through the chat too.
Yeah. Oh, great. And that's an important thing. See down the bottom here on the right, there's this blue icon, the feedback. It looks like it might be a chat thing, but it's not. If you clicked on that blue circular icon at the bottom of any pathway, you can provide feedback on a pathway and say, look, you've misspelt something, or why haven't you got this in there, or whatever it may be, or did you know we've updated our service? So that comes to me, and then I respond to that. So feedback is important, and so if you can hit that feedback button and use it when you need to say this needs to be updated, or I can't find something, then I will get in contact with you. You know, that's what happens. All right. So what I wanted to do now is go to termination of pregnancy. So I'll type in top because I know it'll probably come up. Maybe it won't. But yeah, because we've got it in brackets. So termination of pregnancy is a pathway again, only last year, I think. So August 20, and it's got contributors as well. So Warren Davis helped us with that one, but we've also had other contributors to that pathway, including getting it from another area first. So it's not as though we've come up with this ourselves. And then it's got background information about termination of pregnancy. So there's quite a lot of detail in there. And then assessment goes through assessing. Then it goes through management. Pregnancy counselling, child protection unit. So it links into all of those things, and maybe there was questions before in another sort of area, but you start to link things in, and GPs, when they're developing these pathways, the GP clinical editors, they're thinking, oh, we should put this or we should put that. Contraception options, termination of pregnancy services. So there are some links here, but there'll be some links further down when you get to the request section. So urgent gynecology assessment, non-directive pregnancy counselling, private termination services, GP colleague referrals. So if I go into the private termination of pregnancy service, because it's really important this information is here, it'll link it to contact their preferred provider of the various practices that offer termination of pregnancy services. And then you can link into it, say, through a medical practice, and it'll have information for referral. And then it will list, the GPs that offer that. So through rural medical practice, it's Melissa Brown that offers that. But Bulli or wherever it may be, they offer quite a lot. And then, Woonona, I meant to say. So in Woonona, you've got options there. They've got their criteria, and then they've got the various GPs, and there's 3 in that area. And then importantly, you've got out of area too. So besides, you've got Shoalhaven and what's offered in the Shoalhaven, Warragee Medical Centre or Warragee Street Medical Centre, and it's Kate Manderson. Now, I'm not sure, we need to be kept up to date, and they're the type of things where hopefully Kate's still there, but I'm not sure about that one. And then out of area, which is really important, Family Planning New South Wales, Macquarie Street Clinic, Mary Stokes, and the private clinic. And again, they open up with information. And, I know that I've updated some of these just recently with information. So
I could see, Steve, when you were scrolling past some of the, not the out of area ones, the local ones, there was a cost included in some of them. There it is. Yeah.
Yeah, we tend not to put costs in there, but for these ones we have done, because costs change, and so you've got to keep it up to date. But the good thing is at the moment that these GPs know that they're listed, because one of the other things, if I go up, I want to go back actually. I think I pressed the right one. I want to go into this one, which is GP colleague referrals, because this pathway is the GPs that have a special interest and they'd like to be known for that special interest. So other GPs can refer to them, refer their patients to them. And these are the categories. And so the gender affirming doctors list, I think there's only a couple of that, ACONs. But aviation and dive, there's a couple in there. Ear microsuction, I think there's one. Hepatitis C management, there's a couple. Ingrown toenail surgery, I think there's one listed at the moment. Iron infusion, there's 1,000 in there. Medical termination of pregnancy. So this one is the same as what you looked at, but it lists the GPs and then it goes into their practice. So you can see there that all the GPs that offer that, both in the Illawarra and the Shoalhaven. As you can see there, Melissa Lamb is in there as well from Nowra. So this is a very popular pathway. It's, it drifts up into the top 10 and it is this year. Skin cancer, I just want to check. I think I added one yesterday. It should appear now. So Mark Burgess, I just put him in yesterday. He contacted me. And so he offers skin cancer checks. There's others in his practice that do as well, but he's requested himself. So, he's got a special interest. And that's really important because I know when I get skin checks done, sometimes you can wait 2-3 months. So it's always, this is an option for you. Okay. Then contraception options, it might get us away from some of these other areas. So contraception. That is a particular pathway. So like we've got a heading here, reproductive health, and then contraception, sterilisation, and then contraception options is under it. So again, there's a big COVID note in that one. And then it's got about seeing other information as well, updated in May last year. And page information for this one, last updated in June of last year. And so it's got detail in there and management, and then it links to a whole lot of different things that is relevant, and then links to general practice with special interests, as I mentioned before, IUDs and things like that. There's a lot of GPs listed for that. Sexual health service and gynecologists. So do you want me to link? I'll just click on gynecologists while I'm there. So say non-urgent gynecology assessment. Again, you can see here that contact the preferred provider, say Wollongong, and then it'll list the clinic information for referrer, and then it'll go into the various practitioners as well, and when they're available. And so, I don't know that you can find this information anywhere else. And then Shoalhaven District Hospital and who's available there, and I don't think there's too much available there. Rashini John is available. So that, and then it gives you information for referrer there as well.
I wonder, Steve, if there's anyone any participants that we have online today that want to quickly have a look at a specific pathway. If you want to just write it in the chat box as we've got about 10 minutes to go, it might be a good chance to look at anything specific.
I'll look at breast health while we're waiting.
Yeah, great idea.
So breast symptoms. So it comes under breast there. You can see on the left in the table of contents, see that one above it with breast pain? We haven't localized that. So when I click on that, it'll go to a Canterbury, New Zealand pathway, but it can still have relevant information, but it's clearly in a yellow and it says it's not been adapted for us. But what we have done is the breast symptoms and that pathway is there. It's got the red flag about repeated consultation about the same breast symptoms. That's a concern. If they keep coming back, that's a red flag. You need to investigate that. And then about breast symptoms, the assessment and management, really important pathway. And then request options as well. And then this pathway was only done last year, November 20, and the contributors, Louise Delaney, clinical editor, and Alan Mekasic, medical specialist in general surgery. Because one of the links down the bottom here is to, it says non-urgent breast surgery assessment, but it actually goes to a broad general, non-urgent general surgery assessment. And then it lists the various specialists, for Illawarra. They've got a whole lot of lists there, and they open up. So Andrew Malouf, and then it's got details about his rooms, etc. So, and then the Shoalhaven and what's available there. So there are options in the Shoalhaven for that area. So,
Steve, is there any specific youth or young people pathway?
Yeah, there is.
That you want to show? Yep.
Yeah, so I think if I put in maybe youth or young person health assessment. So that particular pathway was it's pretty original to our area. It's back last reviewed in December, last updated in May last year. So it goes through, the red flags for youth health assessment, about assessing using a HEADS assessment, and you click on that and it goes through some questions and things that, so it's a full link there. So it goes into some of the questions, and then you can look into that for drug and alcohol, just to help a GP in asking those questions. So do you drink or smoke? Do you, there's some things that may be teaching them to suck eggs, but other things that's really going to help them. And sometimes you don't know whether you're teaching them to suck eggs or not. And then management. And, again, it links to other pathways, child or young person at risk pathway. And that pathway, the child or young person at risk one, is being reviewed at the moment. Headspace, counselling, emergency assessment, youth counselling, etc. So there's links in there. So when I go back to that child and young person at risk, there, that page information, last done in May 18, and it's only a small pathway, but it's really providing information about the request options there. Yeah. Okay, so I looked at that one, general surgery assessment. Endometriosis. So if we go to gynecology, so when you scroll down this table of contents on the left, there's a women's health section. So you click on women's health, you can see all the women's health areas. We've been into a couple of them, like contraception. So if I was to go into endometriosis, so I think probably in regard to gynecology, you'll see all the gynecology pathways, and some of these are being reviewed at the moment, but endometriosis is a pathway that is there, and it's got information about it. And then, it's quite a lot of information, and then assessment and management information, and then request options as well. So, important pathway. Other ones, menopause, it's currently in review at the moment, but it's a popular pathway. So there's information in there. See also menopause hormone therapy, and then assessment, management, and referral options, and clinical resources and patient information as well. So that's that one. One that I think, hypoglycemia, let's see if I can spell this right. Hypoglycemia in pregnancy. So we'll go into that one. This is a very popular pathway. And one of the important things about Health Pathways is that we come to an agreement between the specialists in the region about, well, what's going to go on this pathway? Because, you're doing things differently here or there. So besides this big COVID note at the top of this pathway, you'll see a clinical editor's note. And it talks about there's a lack of ongoing consensus everywhere about accuracy of screening and diagnostic cutoff levels. But it talks about the one that we're choosing at the moment. But more importantly, it talks about, in the meantime, cutoff levels across the Illawarra and Shoalhaven are agreed. So we got agreement on that, but the choice of testing differs between services. So therefore, the cutoff levels for diagnosis prior to 12 weeks in this pathway are consistent with But you'll see for Illawarra and Shoalhaven, there's a difference in some of the cutoff levels. So it's important that information is in there, so that GPs know when they're referring their patients in regard to these areas. And they can refer to non-urgent diabetes, and any patients who meet criteria with antenatal screening, there's a criteria there as well. But non-urgent diabetes assessment, and then there's referral options. So for the Shoalhaven, the diabetes clinic, and it talks about service criteria, exclusions, and the information for referrer, what they need as well, which may be different to what's in the Illawarra. Okay, I talked about antenatal. I haven't got very long, so I'm not sure if antenatal.
We've flown through. We've got about 4 minutes left, and there's been some great feedback that have come through the chat box. Just while you're opening up that chat box, participants who are still online, you will receive a follow-up email just with the login and the password details again, so you don't have to feel like you need to remember those from the slides, and also the Survey Monkey, which is great to be able to get some feedback around this session, really around the audio and visual, and also this is kind of the first one that we've used a live website run through, and I feel like it's been great, but it'd be great to get your feedback on that as well. It's been really fantastic to have Steve go through it live. But I'll let you finish up, Steve, on this one.
I suppose because it's one of our most popular pathways,
that'd be great.
First consult, because the teams are both in the Illawarra and the Shoalhaven, the clinical nurse consultants or specialists that work in antenatal, do a great job of keeping GPs informed about shared care for antenatal, and they attend sessions at various times through the year, but they're certainly relying on these pathways. So, and there's information in there for COVID that we've had to keep up to date because it's different during the COVID period for Illawarra, Shoalhaven, and also Wollongong and Shoalhaven Hospital here. So it's all information's there, and last updated in February, 3rd of February this year. And then, of course, the pathway, which is well visited, and they go into the area that they need in regard to assessment management, and also request options, for non-urgent obstetric assessment, etc., and a whole lot of other things. So there's a number of things that I haven't covered today, and things, if I had more time, as mentioned, the hepatitis C pathway. Have a look at that. Smoking cessation is another one where there's, it's well used, and there's a lot of information on there, and a lot of for the Aboriginal community. Perinatal mental health, and I haven't gone into mental health, but it's an important area, and occupation, adult psychology and counselling services. So it's hard to find, but there's quite a lot of information, and even daily living support, which is a massive pathway as far as having information in there. It may not look like it on the surface, but it's got a lot of information about accommodation, homeless services, financial, mental health support groups. So you just click on that mental health support groups and look in the Illawarra, and they're updated all the time. So either coordinator letting me know of changes to company that are under contract, or the particular service is letting me know of an update in regard to their service. So there's a whole lot of information you can drill down. And then this environmental adversity one is just a broad one when we have natural disasters. So whether it's fire, flood, drought, that we can put the latest information in there because that's changing. There's services added. So we just add it to this one particular pathway. But searching is probably the best way to find that information.
Be able to find it. Yeah, I think that the links have been really great. The feedback that have come through the chat is that it's great to connect, and all of those links that are updated, which is fantastic. And the navigation seems to really work about what you're thinking about next is on that next line. So that's really great. I'll take us back to the slideshow so we can put your details up on the screen.
Cool, yeah.
There's Steve there.
I'll stop sharing, sorry.
No, I've taken over anyway.
Have you? Okay.
I've got the power.
Okay.
So there's Steve's details there, and we'll put that in the follow-up email, as well as the Survey Monkey link, which would be fantastic if you guys could complete that, so that we can make sure that our webinars are as best quality as we can do for you. And yeah, it's just been a really comprehensive session. Thanks so much, Steve, for joining us, and thanks everybody in the chat box and all the participants who have signed in. We will wrap up here, but if there are any outstanding questions in the chat box, I'm sure we can answer them. So thanks so much.
Yeah, thank you, Maddie. And I'll take that pride flag information back.
Yeah.
Mm.
Yeah. There's some great comments in the chat.
I'll stop my video now.
Everyone's just signing off. Just leave me hanging, Steve. Now it's just me on the video. I will save the chat too, because there's been some really nice comments. Okay, we're done.
Okay, cool.
Yeah.
Thanks, Maddie.
Thank you.
I'll press that and open the door and
yes, come on out. So